Hey, everybody. It's Karen Anderson here with Aortic Hope. And I have
Terry Cook from Aortic Hope.
Terry Cook. We are trying something very exciting and very different. So, Terry, you weren't even part of Aortic Hope when we first started Ask a Doctor. And I'll tell you, when I met Dr. Prakash back in 2018, he was just so lovely and so kind. And, it was a crazy idea to think that we could ask a doctor to take some time and answer questions on a Facebook page. And he said, sure. And, what I thought was going to be maybe, I don't know, a half hour to an hour, he has dedicated
Your
every other
mic's
month,
not picking up.
2.5. You're not
Yeah.
picking up. Can you hear me
No,
now?
we hear you, but
I don't
it's
know
not
what's going
coming through your
on.
good mic. It's coming through your computer
Eh,
speakers.
that's just so odd to me.
I don't know. Why do you keep
I
messing with your gear? This is you,
don't
doll.
mess
You do
with
this.
anything. You don't hear that? I don't
telling
know
you. I'm
what's
telling
going
you.
on. Anyway, I don't want to switch anything. You know why? Because things are going to start turning. Is that better?
No,
Anything?
not yet.
I don't know. I can start pulling out cords, but then I don't know what's going to happen. Because,
I'm just
it's a
impressed.
little hard.
What did you do last time where you had to twist something?
This is the cord. Hold on.
Yep,
Let
just
me think of
yank it.
I'm just impressed that you
better?
could figure that out, Josh.
You sound
How's
better
that?
than she does right now, Terry.
That's not better?
Oh, no, my AirPods.
Nope.
Yeah. I don't know.
There's a little plug on the bottom of the microphone. Just give that a yank.
I'm in there. I did it. I did my fans. All right. The microphone's gone.
That's that. Let's sigh.
I have my other trusty backups. I don't know what to say. There's going to be something that's going to happen when you try something new, right? So let's try this. Let's see if I had any of these charged, and that would be a miracle. I've just heard miracle of miracles, blah, 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 blah. How's that? Is that better?
You have to go into Teams and make sure that you choose the right microphone. Also, I'm not sure if that's on. Is it on?
Turned it on.
Can't tell.
I don't know.
Well, while you figure that out, Karen, I can tell you that you are 100% correct. I actually have met Dr. Prakash twice now, and he is just so informational, so wonderful to talk to. He talks to you on a level that's not like a high up level. Like, you can understand everything he says. He explains everything. The last time I saw him, he actually had samples of things that stents and graphs, and it was kind of cool. And he's just great to listen to.
I figured out the problem.
I bet
Is that
you
better?
did. Yeah.
You want to know what the problem was? Is that evidently my headset must have some kind of microphone.
Yep.
But I don't think I have that, set up. Anyway, okay, getting back. Yes. So Dr. Prakash has been wonderful. And he, he dedicates like 2.5, 3 hours of his night sometimes to just answering questions for everybody. And this has turned into many years now. So we have also had him on here, right, on our YouTube channel. And that worked out equally as well. So tonight we're trying this tag team approach where we've got questions going up live right now as we're speaking on our Facebook page. So that is option 1. And when he gets a chance to officially jump on, which should be any minute now, he'll start typing away, answering those questions. And I'm going to read them here, and we're going to answer them here for all of you, because it's very interesting, right? To hear people's issues, questions, thoughts, and hear the answers. And then,
well, also,
if people
I
are
want to
watching us here.
I want to jump in here and go over the technical reason why we're also on YouTube. Facebook requires that you authenticate in. Otherwise, you cannot see the question answers that are happening for Dr. Prakash. By broadcasting through YouTube, we're giving people an opportunity to hear some of these questions and answers, and then click the link on our website and go straight into Facebook, and voila, you authenticate in. You can interact directly with Dr. Prakash, but in the meantime,
that's right.
This is going to be an hour-long commercial of Ask a Doctor with Dr. Prakash.
Commercial.
That's right. It really is, because while we're doing this here, you guys can also place comments here during this live event, and we will type in your question into Facebook and let him answer it. And if you want to be anonymous, Josh, can we post that anonymous question link? Because I'm taking anonymous questions too, because the Facebook page is public. But I will say, before we even get started on any of that, you got to click like. Wherever direction it might, I think it's down, right? Got to click like, you got to click subscribe, please, and click the bell so that you're notified every time we go live. We always go live on Mondays, typically, most Mondays, 3 p.m. We go over all of our posts and we go live for events like this, spontaneous, let's just try something new event. We go live interviewing people. We've got a great live event in a week where we talk to individuals from Dougherty, Chelakeen, and Associates about navigating Social Security disability. And then we have brave souls who decide to tell their survivor stories. So that's also important because you can ask questions of them. So that's what we got with that. I'm checking now to see if Dr. Prakash is on. We have quite a few questions already popping up on the page, but I don't want to read them. I don't want to read them until I see
that he's pinging in the responses.
That he started answering them. So let's check it out. Let's see what we got. You can. I can see. You can't see. Well, you can see, Terry, but
no, I can't.
Because you could look too at the same time.
I could.
Let's read more comments. Let's see what we got.
Karen, let me talk.
Okay, let's see if we have any of these answered just yet.
Can she hear me?
I feel like all the way down. I can hear you.
Okay, I'm going to go all the way to the beginning. Let's see. All right, we have got. Here's the first one. How about exercising? Exercising, like, I don't know what HITT stands for. Josh, you were trying to come up with it.
Hyper or
can't hear
high
you.
Impact. Can you not hear me?
No, see, now you just pushed a button, Terry.
No. I hear her.
Well, you did, because now
you don't hear me.
Oh.
Josh, you hear me?
I hear you. Do you hear me?
You know what?
You have to change. You have to change your headset.
It's me.
Thing.
It's my issue. It's not you.
Can you hear me now?
Not until she changes. Oh, you got her now?
Totally hear you. Totally hear you now. So
okay.
HITT.
Okay. High intensity interval training.
Okay, thanks, Josh.
Oh, so it's not HITT, it's HIIT.
IT, correct.
Okay.
We are not, I'm told we're not supposed to do it, or at least I'm not supposed to do it.
Yeah. So how about exercising like high intensity interval training on an elliptical bike or bike riding up steep terrain or backpacking with BAV? This person's ascending aneurysm is 4.3 centimeters, and this person has moderate stenosis with no regurgitation or symptoms. 55-year-old male, very active, thin, normally low blood pressure, and a really good resting heart rate. He's also looking for ways to build muscle and bone strength. And Dr. Prakash says, hi, everybody. Aerobic exercise is great for people with bicuspid aortic valve as long as you have regular checkups to make sure that your blood pressure is well controlled and your aortic diameters are not changing. When you increase the length or intensity of exercise, please consult with your aortic specialist and start at an intermediate pace before ramping up. That way, you're less likely to strain your blood pressures. Well, there you go.
Exactly.
That's a great answer. But I myself would probably start at the very baby beginner. I wouldn't.
Yes, you would.
Put me at the baby beginner stage, baby boo bear stage. All right, let's find another one. Here's another one that's been answered. All right, so this is great considering this time of year. What do having really bad, numerous upper respiratory tract infections do to our bodies? And should we be concerned when you have aortic disease? Look. Boom. I know that we all get nervous. Like we're coughing. I mean, think about it. You've had a baby. I've had a baby. And what's one of the things you wonder when you find out you're pregnant? You're like, oh my God, if I sneeze, is just going to sneeze right out. Every woman wonders the same thing. So when you have an aneurysm where you've had a dissection, I know for me, I was always frantic. Like I have to cough. I have to sneeze. Like how am I not imploding my insides? I'm sure you probably thought the same thing, right?
Absolutely.
Yeah.
And it's like, okay, how sturdy are those wires around my sternum? If I cough or I sneeze, is one gonna pop through?
Exactly.
Yes.
Exactly.
Totally. It's like I actually, since my dissection, I actually kind of stifle my sneezes. I actually did it today. I'm like,
so whereas I'm like, chew. Just let it go. Well, Dr. Prakash says, and this is important, and you all should hear this. And I don't care what your thoughts are, whether it's flu, COVID flu, shingles, just really bad bronchitis, whatever the case is, infections of any kind increase inflammation in the body, period. So just think about this. If you have your gallbladders going bad and it gets infected, that's creating inflammation. So this isn't it's not a political thing. This is what's going to happen to your body physiologically. You have an infection, call it whatever you want. It can increase inflammation within your body. And while it has not been proven, it has not been proven. Unlike some posts I read in certain pages, it has not been proven to cause an aortic dissection. Inflammation is now believed to play a role in increasing the rate at which aortic disease may progress in some people. A lot of variables in that sentence. But the link between transient infections and inflammation in the blood vessels is an active area of research. So what I know, just from having had Crohn's disease, and again, like he said, doesn't apply to everybody, is when your inflammation markers run high, and the average of a CRP, C-reactive protein, is one of a couple tests, I think, that tests for inflammation, should usually be like between 0 and 4. Well, mine could be 13, 15. I know people who had them as high as 30. When you have inflammation, your heart works harder to help rid the body. Well, I would think logically, if you have the opportunity to have an aneurysm form genetically, if you already have one and your heart's working harder, in my mind, it would make me feel like, well, could this aneurysm increase? And so what Prakash is saying is it's believed to play a role at the rate in which this aortic disease can progress, but it really varies between people. So I don't know. Bottom line for me, I'm taking whatever precautions I can. I've had a second hospital system here now in Maryland that's under mask mandate. You're starting to see them pop up more and more. That could be because adults are having RSV, now. So
there's
I don't want what I had. So I don't know. What are your thoughts?
I've heard a lot of things as well, that RSV is just not, people used to think that it was just for babies, but there's adults getting RSV, and I hear a lot of it now. A lot of it.
All right. Someone asked if factor V could play a part in aortic disease. So factor V would not. It's unlikely. Factor V is something genetic that affects blood coagulation. So the ability for blood to clot or overclot, and has no known role in causing aortic aneurysms or dissections. Okay. Here's another question. Don't smile if you think these questions sound like things I've spoken about. It's merely purely coincidental. If you have the FLNC gene, and could that cause arrhythmia, SVTs, PVCs, PACs, or could the rhythm changes be due to having COVID twice? Now that I've heard people in the community talk about arrhythmias. And he said FLNC mutations may cause cardiomyopathy or weakness of the heart muscle. If you have cardiomyopathy, you could develop arrhythmias. So I guess if you don't technically have issues with your heart function, then it wouldn't be because of that. So you would need to have your heart checked out probably by electrophysiologist. But the question of, is COVID now long COVID reporting to have a lot more arrhythmias? And I've heard that a few times, but I may pop that question in. All right, let's see.
I mean,
no,
of
please.
course, I'm not a doctor, and we're not doctors, we're not
right.
healthcare specialists, whatever. But I still think there's so much unknown about COVID and what it's going to do in the long term, or does it affect aortic dissection, or what does it affect? Will it affect? It's just, I think there's so many unknowns that I'm not even sure Dr. Prakash can say. I mean, he'll know one way or the other right now, but in 10 years, what's going to happen?
Exactly. Yeah, exactly. Who knows what we'll hear about once they start, really testing and looking at people.
Testing, correct.
I'm trying to see. All right, newest comments first. Okay, let's see some more comments here, and then I want to hear your thoughts on some of these questions. All right. Wow. Okay. That one has not been answered yet. If you have a dissection, should CPR be performed on you? So you've already had a dissection. It could have been years ago, and here it is. You go into cardiac arrest. Should somebody be actually doing chest compressions? What do you think the answer is?
That is a great question.
What do you think it is?
I think the answer is yes. Well, okay, so a dissection or open heart surgery, they're not the same, right?
This is true.
So if you want to say dissection, I would say yes. If you have open heart surgery, I have no idea, and I really should know.
Well, I think that the answer standardly is yes. CPR can keep you alive long enough for you to
Right.
get to the operating room if you needed to have your aorta repaired or there was an issue with your heart. Cost benefit.
Right. I was going to say, to be honest with you,
Yeah.
if God forbid I needed CPR and it was a matter of hurting my chest or not and saving me, please save me. My
Yeah,
chest
you
can be
too.
fixed.
You
Yeah.
too. I'll be right there.
Yeah.
All right. Do any of the medications typically prescribed for aortic disease cause weight gain? Yes. Beta
Right.
blockers like atenolol, metoprolol can cause weight gain in some people. And most people do okay and don't gain a lot of weight, especially if they stay active, but it can cause weight gain. And I will tell you, I noticed weight gain when I double dosed. I double dosed, and then it hit right when I hit my double whack of menopause. I was like, it doesn't matter what the reason is now because I got to be on the beta blocker. So,
Right. But it's
you know,
the problem is it's like it's a double-edged sword.
right.
If I lose weight or if you lose weight, hopefully maybe you can get off of some of your medications, but the medication you're on right now makes you gain weight. It's it's hard to figure out and it's
Right.
hard to do. And yeah, this age is not fun.
Not fun.
I just
Not fun.
dropped again.
But you know what? You made an emphasis. That was an emphasizing moment, and I felt it. I
When my
felt it.
phone
I
dropped.
get it. Yes, I got it.
Yeah. Yeah,
Do you know
it's
what
just hard.
Turner syndrome is? Do you have any idea what Turner syndrome is?
I do.
Yeah.
Josh does. What is it?
It is not like homies with an extra chromie, but it is that kind. It's a chromosomal situation that only affects women.
That is true. Never heard the homies with an extra chromie, but Turner syndrome is caused by a missing part of the X chromosome or one entire X chromosome in a young girl or woman. It affects about 1 in 2,000 people and is common cause of aortic aneurysms, bicuspid aortic valve, and aortic dissections. And all people with Turner syndrome are at risk for aortic disease and should see a cardiovascular specialist regularly. You were right on the money. Right on the money there. Yep. So that's why it's not considered a genetic or connective tissue type of syndrome. It is part of your chromosomal. Yeah, it's different.
Yeah. On the Emotional Grit podcast, we interviewed a lady that had Turner syndrome, and she was adopted, and she was going to have trouble having children, and so she in turn went and adopted another girl with Turner syndrome and just kind of raised her and helped her learn what her life was going to be like. Yeah, it was a wonderful,
wonderful.
podcast.
That's so cool.
That's really lovely. Yeah.
That is really cool.
Hey, do you know why some people have AFib after dissections? Because I didn't know that it was actually a thing, but I've seen a lot of people in the community talk about having AFib. So you got AFib after, so I take it went away.
Yes, it did. It did.
Okay.
I had AFib. It was probably 3 or 4 weeks after my dissection and my surgery. Part of it they think was caused because I was not on the right amounts of medication.
Okay.
But it did happen. And they said it is kind of, it's normal that it can happen.
They say AFib. Yeah. Oh, no, I've heard, especially if you need
fun.
to have that sucker reset.
Okay.
So
you're going to have to explain what AFib is.
I am. AFib or atrial fibrillation, so that's just a shorter way of saying that really long word. It's actually the most common type of abnormal heart rhythm. Any type of acute cardiovascular condition, such as a heart attack, stroke, or dissection, can actually trigger AFib because it's due to severe physical stress on the heart. So any of those things can actually cause your heart to kind of wick into this like weird rhythm. And you have to hope that it goes back, or they might have to shock, like literally hit you with the paddles while you're awake, kind of sort of sedated, but not really sedated, or you might need to have an ablation. So that's endovascular go up and then they do something in there type thing. Yeah, it's not fun. Yeah, not pleasant. All right, let's keep seeing. Yeah, go ahead.
I guess there's another question that we can pose. I know people that have AFib. You can live with AFib, correct?
Oh, sure. And just because you have AFib doesn't mean everybody has to be on Eliquis either, which is, what I think people think. You can, you just don't want to end. So one of the problems with having AFib, the way I understand it, is you can have a stroke because it's throwing these weird, fast, bizarre rhythms,
Correct. Yeah.
So it's definitely something you want to take seriously.
Absolutely.
All right. This is a really good question because we know there's a lot of community members that love their supplements.
Mm-hmm.
And I'm not talking vitamins like magnesium or B12. I'm talking supplements that doctors don't usually prescribe these supplements. And that's fine. Totally not saying anything negative if you're into your supplements, but definitely check with your physician before you just arbitrarily take things. But the question is, if someone has a connective tissue disorder or knows they have a variant in COL3A1 and COL5A, not anything I've ever heard of, but clearly this person understands what they have. Would collagen supplements help them at all if their body isn't utilizing or making it properly alone? So it sounds like it is a collagen type, some kind of deficiency, genetic issue. And the answer simply is no. Unfortunately, the collagen that you take in gets broken down into amino acids like any other food. So that's interesting. People that think they should be drinking this collagen packets, taking it in, it's getting burned up. I don't think it's getting past the gut, basically. Eating a balanced diet is going to be your best way to boost your body's production of collagen. Eat the right foods that will then create the collagen. Ingesting collagen is just going to get burned up. It's just going to go bye-bye in the belly. But as one orthopedic doctor once said when asked, should I take glucosamine and chondroitin, or I can't say it right. His answer was, if you think it works for you, then you should take it. So there's that, right? Okay. All right. So let's see. Let's see if we've got any other ones. I'm going to refresh the screen here. While I'm refreshing, you want to talk to everybody a little bit about your thoughts on our belt covers?
Oh my gosh, our belt covers, our seatbelt covers are amazing. They're in all kinds of colors. We have red, we have yellow, we have black, because I'm all about the colors. But they're not just for aortic dissection. They're not just for aortic disease. We have them for Marfan syndrome. We have them for a lot of other issues and diseases. And the best thing about it is, first of all, it helps the seatbelt because, I'm kind of vertically challenged. I'm only 5'1", and the seatbelts constantly cut my neck. So I tried this big fur thing. Yeah, it didn't. It looked good, but it didn't work. So this actually has a twofold purpose for me. It signals that I have an aortic dissection, and it kind of helps the seatbelt from, cutting my neck. The other great thing about it is that in the inside of it, there is an emergency card. So first of all, God forbid you're in an accident or you pass out, whatever. Not only do you have that seatbelt cover to alert the EMTs, also if they go inside, you have the emergency number because you may not be able to talk. And you fill those out and it tells you can put on there what you're allergic to. You can put your emergency contact information. Mm-hmm. So you should have one for every car. Not even every car you drive, every car that you're in. I technically should have 3. I have 3 cars between my husband and my son, that I should have one in every single car.
Yeah.
Granted, if I'm not driving and one of them are driving, they know what's wrong, but still.
Right.
So yeah, I need to order some more.
I know. I need to get a new one too. Yeah, but you were right. Red, yellow, black, abdominal aortic aneurysm, thoracic aortic aneurysm, aortic dissection, medic alert, Loeys-Dietz syndrome, Marfan syndrome, vascular Ehlers-Danlos, and now pacemaker and blood thinners.
Nice.
Yeah, those are some new ones. Yeah, and they're awesome because they Velcro. And the other thing is when the weather breaks and people start taking little hikes, you throw it on your fanny pack. You can throw it on a backpack. If you're taking a bike ride, you can throw it on one of the bars on the bike. Because if something happens to you, you want someone to know what's going on with you, right?
If you're pushing a stroller, a jogging stroller, put it on
Walking your dog, throw it on the leash.
Put it on the leash. Exactly.
All right, let's get back to some more questions. Kind of digging this format now that we got past all of the, technical stuff.
Technical difficulties.
The difficulties. All right. What connective tissue disorders are considered as factors for surgery? I'm thinking the question means more like what connective tissue disorders are taken into consideration when determining when somebody should have surgery. So all conditions that cause fragility of connective tissue or potential risks during surgery, because healing of wounds may be delayed and bleeding may increase. I did not know this. This is why I love doing this, because I feel like I learn something new every time, right? The specific risks are better understood for some conditions than for others. Please check with your aortic or cardiovascular specialist before undergoing any elective surgery if you have one of those conditions. So he took that question in a different direction. I didn't see that coming, but that's an interesting twist to that question. If you're going to have surgery completely unrelated and you have a connective tissue disorder, I'm hearing from what he's saying that you should take this into consideration. It should be discussed with your physician. Interesting. Very interesting. All right. This one's a good one because we talk about this a lot. All right. Is it common to have ocular disturbances after open heart surgery? I really want to know if it is common, because it sure seems like it is pretty common, right? Everybody talks about it. Yeah. They talk about it all the time. This particular person had ocular migraines, peripheral vision loss, triple vision in months after the open heart surgery, and was on 320 milligrams of valsartan, which eventually got cut in half. This person noticed no more vision issues after that. Rare if they ever did occur. That's interesting. Now back on 320 milligrams again of that same particular medication, and the triple vision and ocular migraines have returned. That would tell me there's a correlation, but right? Okay, I don't know. Call me crazy. Yeah. But we're not doctors. All right. No. This person's scheduled for an ophthalmologist to see an ophthalmologist next week to be safe, but was wondering what experience he might have seen with this complaint. So the doctor says, I feel like we're gossiping late at night, and the doctor says, please, would not be unlike us, right?
You said it, not me.
But it's the truth. All right, please check your blood pressure carefully when you do have these ocular symptoms and when you don't. That's interesting to make that comparison, because it could be that your blood pressure drops when you're having the vision change. So it's not that the blood pressure drops and then the vision happens. It could be that the vision thing happens and then the blood pressure drops, right? And in some cases, reducing the medication dosage or changing the timing of the medication might actually prevent those side effects. So he orders a 24-hour ambulatory blood pressure cuff. It's just a 24-hour blood pressure check. It's something that you wear. You don't take it off. If you're like driving or you're doing stuff around the house and it goes off, you're supposed to make your arm straight. It's annoying because it'll happen while you're sleeping. It is what it is, but it checks it and knows when things happen and how you were positionally, basically. Using that device or having that prescribed for you as a diagnostic tool can actually define the issues in their clinic. So check with your doctor and see if this might be an option for you. So I guess for all of you out there having these vision issues, take a peek, see if you can capture what your blood pressure was like during that or maybe just after.
Yeah. The other thing too, I'd be interested, now that you brought this up, this was brought up by the community member. I wonder how many different diseases, not aortic disease, but other diseases can affect your vision. I know my husband is diabetic, and when his sugar's not right, it affects his vision. And what else can affect your vision?
That's interesting.
Mine is old age, but
so's mine. Well, you know what? Let me tell you, I started having migraines when I went into puberty. I thought I was going blind. I was in elementary school, called my mom with the school nurse from the office on the rotary phone, because yes, I'm old. And she came up and met me, went to the doctor, and he's like, she's having migraines. And then there was a whole period of my life they went away. And then boom, I have this dissection. And then they like came back with a vengeance. Double vision, eyes feeling crossed. So I actually went and saw a migraine specialist because for a while I thought that I was having many TIAs, because complex migraines mimic. You can have drooping on one side of your face, speech issues, freezing cold temperature. I get physical migraines. I used to get strictly visual. You see the little dot and it grows and grows and it's triangles everywhere. And but now I get physical symptoms. So I spoke with this complex migraine specialist and they put me on Emgality, which is just like Ajovy. So it's one shot a month. And I'll tell you what, I'm getting more headaches. This is the first since December. I haven't had a headache since November.
Don't say it.
Well,
Don't say it.
but this
Just
is what's
think it,
supposed to
don't say it.
happen.
You
It's
did this to
supposed to make them
yourself.
all go away.
Yeah.
Well, we'll see. It better not jinx me. I'd be really, really.
I know. That's
really
why I said not say anything. Don't say it.
All right, let's go back to another question. We have a 70-year-old woman who was diagnosed with a dilated ascending aorta a year ago, and it was 3.9 at that time. So that would be considered mildly dilated.
Mhm.
This year it increased to 4.1. Be interesting to hear what he has to say, because that's 2 millimeters in 1 year. And what I thought was growth was 3 millimeters or more in a year. So I'm not a doctor. I don't know what I'm talking about, but I do know that this is some of the things I've heard, but this is still interesting. Plus, did you have the same exact test? Was it done in the same facility? Was it a gated CT? There are so many questions in here, right?
Just to correct what you said, you are not a doctor, but you
Right.
do know a lot of stuff. You said you don't know. You do,
I
Karen.
regurgitate. I parrot what
You-
I listen, and
you
whatever
know a
I can
lot.
remember pops out, and it lives in memory banks that I don't even remember where those memory banks are. How's that?
That's okay, but you do know a
Thank you.
lot.
Thank you.
You don't.
But don't anybody ever take my word for it. I'm great
Okay.
on giving support. Don't take my medical words. I am just reading words. I am not advising anybody to do anything, for the record.
But you
All right.
understand. Let me repeat that. You understand everything.
I do
the most
understand a
part.
lot.
Yeah.
I do.
Yeah.
I do. I try.
Anyways,
Try.
back to
All right. So when this person was diagnosed, they also were given a treadmill stress test and was told that they have exercise-induced hypertension. That's interesting. During the stress test, their max heart rate was 144.
okay.
BP went 215 over 82.
Wow.
Yeah. Other than exercising, blood pressure is normally normal to low. This person does not need to take or has not been prescribed blood pressure medication. Very active, rides their horse competitively, high intensity workouts. The question is, what guidelines should this person follow when working out, and what's the best way to monitor it? This is interesting. Okay, let's get into some good information. I'm dying to know. All right, so high blood pressure during exercise or rapid variations in blood pressure are both very common, especially after age 60. Well, there you go. That, I feel like now we can take a deep breath and exhale. Okay, that's good to know. Dr. Prakash and some other aortic doctors use the ambulatory 24-hour blood pressure monitors. It's called an ABPM, to determine how your blood pressure actually reacts in response to exercise and activities. And in some cases, this can actually lead to changes in how your doctor prescribes your blood pressure medication. That might also include the timing of the medication so that it becomes more active when you become more active. So there's a whole science. I'm not sure how many people realize this is why your doctors say to take a medication at a certain time, because sometimes these meds don't even kick in for like 2 or 3 hours. So they can actually look at what happens when you are active in this 24-hour monitor and say, let's change a medication, or let's change when you take it so that it's in full effect when you want to be active. But definitely check with your specialist to see if this is an option. Well, that makes sense. Maybe then you won't have a blood pressure of 215 when you're exercising, because your meds will take effect. That's high.
That would just make my blood pressure go even higher.
I know. Mine just went.
If I saw that, I'd be.
Yeah. I'd be the person on the floor, just.
Yeah.
Right. Oh,
well,
freak out.
It's interesting too what you say about, talk to your doctors and find out when you should take your medication depending on certain times. I happened to go to the doctor yesterday, and it was first thing in the morning. I took my medicine at like 8 o'clock. My appointment was at 8:30. They took my blood pressure, and my blood pressure was fine. I was like, well, that's because I just took my medicine. No, it was from last night or the night before, because I'm on a regimen. I take it certain days, and that's why I take some in the morning and some in the night, so that it's controlled all through the day, and that way it stays where it should be the entire day per my doctor's directions.
I know when you take your meds because I hear the alarm go off.
Yeah.
And we know when our friend takes her meds because her mama calls her. Right? Hey, whatever makes the family members, feeling really happy. And with that, let's take a second for two things. One, Josh, do we have any questions from the community that I should be typing into the doctor?
Oh, I'll be copying and pasting them into the anonymous form for you. But so far, I want to say hi to John Brenny. Hi to Molly
Hi,
Thomas.
John Brenny. Hi, Molly Thomas.
I said to John, man, I'm so ready to see the Ravens make Swift fans cry.
Yeah.
Well, now that you brought that up, I just have to tell a quick story. So one of my advisor at work, his sister-in-law works for the Ravens, and she's in charge of all the press and the things like that. So several years ago, George Clooney came, and she had to do like, black window limousines and all of this and that. Can you imagine what she's going to have to do on Sunday for Taylor Swift to get her in here without people seeing her? Should be interesting.
I mean, she might as well like take a parachute in.
That Jason Kelsey with his shirt off the whole time.
Go on, you guys feel free to chat for a second as I add whatever comments have just come in.
I think they're going to shut them down. I think they're going to get super frustrated. The Chiefs might score 10 points.
From your lips to God's ears.
Right, and I hope it's not one of these situations where some random person catches a punt and accidentally runs it all the way back.
All the way back.
This playoff season has been fantastic, though. Like, fantastic. Yes. Can you believe the Packers just... Like, how did they do that?
I know.
Right?
I know. We could turn this Aortic Ask a Doctor into a football talk real fast. My husband's over here in the living room, and he'd probably join us real fast. But all
right, I have gotten all of the... I've grabbed all of the online questions now and added them, and let's take a look at some more of the questions and answers. Let me pull them up. But I do want to say today is January 23rd. Do you know what that is?
1, 2, 3.
And what does that mean?
Oh, it really does mean.
I'm muted. It's Caregiver Day.
It's Caregiver Day. Why January 23rd?
Because it's easy as 1, 2, 3.
That's right. They make giving care look as easy as 1, 2, 3. And honestly, it was also today because it's a day that I know that patients and survivors can remember. 1, 2, 3, right? Because if we made it some obscure, bizarre, we would not necessarily, remember. But 1, 2, 3, easy to remember. So thank you to all of our caregivers. We do appreciate all of you. All right, let's get back to some questions and some answers. Here we go. It's filling up. It's coming in. All right, we have got type B, medically managed with genetic connective tissue Marfan and EDS umbrella, plus primary, I can't pronounce the word, Sjogren's. When you put a letter S in front of a J, I'm done. You put in a letter with a number like A squared, why are we doing, why are we Xing and Ying? Dancing, she might have some other, there's a lot of acronyms and things here, so I'm not 100% what's meant, but having some other aortic issues. Canadians looking for Canadians, not a lot of centers. Having some issues, not a lot of centers. Calgary and Toronto, however, for all of our Canadian friends, Calgary and Toronto have great aortic centers. They do genetic testing to identify the cause of aortic disease, and some of the best surgeons in the world actually work there. So this person seems to be having some issues. We take for granted sometimes. I know we like to complain a lot about our health system,
healthcare,
but access is in some cases a lot easier for us to get to, and we have more centers to have access to. And on that note, Aortic Hope right now is working on putting together as much of a comprehensive list that we can of aortic disease centers. They may not be called disease centers, but what we know is that there's at least a vascular, thoracic, and cardiologist. So for all intents, it is one. These could be also Marfan designated centers. So we're up to about 400. So we're working our way, and there is no master list that exists. So we're getting there. All right. Love to our Canadian friends. Here's another one. Okay, we already read that one. All right. Also vision issues since an aortic dissection, just to get back to that question we had, can also indicate a blood vessel problem or an eye problem. So whenever anybody here, I don't care if it's an ocular migraine, if this is new to you or happening more frequently, this is when you do want to see your eye doctor. because there could actually be something going on. And for myself, I've had my retinas detached, both detached. And this was years, like, whatever, 40 to not 40. How old am I? It was 20 years before my dissection. No, yeah, yes, 20. So this was way before any of the aortic issues, but I had to see a retina specialist every year, maybe every 2, just to double check that there aren't any issues going on. Okay, let's see.
Hold on, don't just blaze past that. Tell us a little bit about what that was like.
What was it like? It's not something I'm having a retinal detachment. I was young. I was like 24 years old, and so I don't want to scare anybody, but I was seeing a lot of spots, look like dirt. We all get this because the vitreous, or the jelly that's in the eyeball, moves. That's what it's supposed to do. And as it moves around, sometimes we see spots, we see little floaters, little wigglies. That's your vitreous. I think that's what it's called. I'm not a doctor. Moving around. But these were spots that stayed in place, and it didn't matter what time of day, it didn't matter what I did, they did not move. They were always there. And after a while, which is crazy that I let it go that long, I finally said something to my parents, got the eye exam, and he said, you've just got a ton of holes in your retina. And I believe you've had a detachment in one, and you can most certainly go blind from a retinal detachment, and very quickly. It is a urgent situation. And when he went in to fix it, which was with me asleep, it's cryotherapy. So they go in with this cold, freezing cold rod. So if your retina detached, right now, it's kind of like a dissection, right? It's kind of detached, just flopped on top of itself. When they touch that with the cold, it shrinks real quick and boop, kind of goes back into place. And there's no stitches inside your retina. It just goes back into place, and I guess it reattaches itself. And that's how they fix it. And when he went to look in the other eye, just to be sure, that one had a small detachment too, that he didn't see at first. So I was so scared. I was so scared I was going to wake up and be blind, because but you're not really, it doesn't hurt. I only remember it feeling like I had really dry eye. But your eyes were tired. That's what it was like, a tired feeling. And it's all done through lasers and freezing sticks, cryo sticks, and all of that.
It's probably even more different now because it was 20 some years ago.
Oh yeah. Yeah.
So
it
I'm
was just
sure
like five years ago.
Do you wear contacts or glasses or anything?
No. I have glasses for reading when I have to wear them to read for sure. And I could be wearing them all the time, but I just don't do it. To see like far away.
You need glasses like mine.
I do. And then I'll never stop. I'll just be buying glasses. Yeah, no, I don't. It didn't affect my vision. I had 20/20 vision till very late in my life, till like my 40s, easy. Yeah, my vision definitely changed after the dissection, though. I feel like it got a lot worse, and I developed ringing in my ears, so like weird things happen.
That's
what?
What is that? What is that
Tinnitus?
Called?
Tinnitus?
Yeah, I was going to say tetanitis. Tetanitis.
Tetanus of the eardrums. Yeah, that's what that was like.
Yeah.
So, yeah. All right. What are the chances of further dissecting after type A and boot? You'll know why I just said boot. Type A and B root to just, you can laugh, it's okay, to just below the diaphragm. After 2 open heart surgeries and frozen elephant trunk, I'm 7 centimeters left unrepaired and dissected. So the answer goes like this, and this is pretty true. It really depends on the genetic mutation and risk factors, such as, do you have hypertension? Because if you still have hypertension, then you could be at risk, right? I'm speaking as the doctor. We know that people with certain genetic mutations may be more likely to experience a second or third aortic problem after an initial type A dissection. This particular person has AHTV mutation. There's been no other answer since then. So that's scary. So, I don't like reading everything sometimes. I'm like, do I have a mutation?
I try not to think about it, but I do get scared. Does it happen again? I don't know.
Well, and I kind of wonder if it happened again, like how much am I really going to be aware? I don't know. I don't like to think about it. I don't think about it.
But then I'm thinking, this is terrible, but good, but terrible, that if God forbid it did happen again, I have so much support now with
Yeah.
aortic hope that I didn't have before.
Yeah.
So,
My
you know,
bigger
that
fear
is
is
a
if it happens.
positive.
But how much layer do you have left? Did you dissect one layer or two layers? So what if you dissected through two? I know I don't even know
Right.
the answer to that question.
I don't know
And
the
I
answer.
dissect, there ain't nothing really left to
No,
rip
there's only
again.
3 layers.
So,
Right.
like, I think if it happens again, I'm like, bye-bye. I don't really know what else to do. All right. How big of an see, somebody else is asking, how big of an impact does coughing or blowing your nose have? But this is a normal question. And I think that a lot of doctors are like, they probably laugh, but maybe they take for granted that we just assume, well, of course it's not that big a deal. But
It is.
especially if you have chronic issues with coughing or, or
Okay.
sneezing or blowing your nose. So coughing or blowing your nose does not have a big impact. Holding back a cough or urge to sneeze might actually make the impact larger because that
makes sense.
is retaining pressure. That
Right.
makes sense. So
That
let
does
it
make
rip,
sense.
people. Blow with your nose. Enjoy your sneeze. All right. This person's husband had an aortic dissection in 2017, aneurysm in 2021, and he was tested for a connective tissue disorder at the discretion. No, after the dissection, I'm tired. After the dissection, because the youngest son has Ehlers-Danlos. Interesting. The husband's test came back negative. That's also interesting. But she still thinks her husband has it, but it came back negative. What's the likelihood of the test being incorrect? That's a great question.
That is a good question. Oh, it was so great I dropped again.
You're emphasizing how good of a question it is. All right. Well, you know what? The test he had in 17 is probably not incorrect. That is such a devil negative that my brain has to, Willy Wonka it and just kind of reverse it. So it's probably correct.
Incorrect. It's correct.
But it could be incomplete. Okay. So since 2017, we've learned a lot about new genes that can cause aneurysms and dissections. And we recommend that all families contact their doctors for retesting after 3 to 5 years because the field of genetics moves so rapidly. We can now test for genes that were not known before. I like to go and even every 5 to 6 years. So I've been tested twice and still keeps coming back variant of unknown significance. Although the second time it now has a name, because I guess that means somebody else has it. Well, then that makes me wonder if somebody else has it, like, could I be related to them in some weird way?
Well, here's the other thing too. It's something that maybe the community or the doctors that deal with us and with aortic disease, maybe that's something that we should advocate, or they somehow should advocate for, that we should be tested every 5 or 6 years because there's constantly new discoveries, that the more data they have, that maybe I never even thought about it because I haven't even thought about being tested again, that maybe that's something that we should advocate for. Advocate for. And
you know, here's how we do it. Look, daylight savings. When you spring forward, everybody goes and checks their batteries in their, what is it? The sprinkler systems, the fire
detector.
Hey, everybody reach out to your genetic counselor, right? Twice a year. Hey, we're falling back. Call back to your genetic counselor. We can add that in. It works for me.
I think it's something to think about.
It is. It is. What should children avoid if they have ACTA2? That would, so specific to aortic dissection. I'm not sure what this question's asking, but we'll just leave it at the
children.
Yeah, children, what should they avoid if they have an ACTA2 mutation?
Okay.
Specific risks related to ACTA2 mutations depend significantly on the type of mutation that the child has and how, like, what's the status of their blood vessels, the aneurysm they might have, or a previous dissection. And recommendations for each child should be customized based upon their own personal risk and the type of activities that they want to actually engage in. So all of that is personally customized. There's many variations and different things that they can customize for each child. And he really can't get into everything here, but that's the type of thing. Talk to your aortic specialist because they're going to know. And if you can find a cardiogeneticist like Dr. Stacy Fisher, that kind of cardiologist really will know a lot of information and can help you with that. So that is that.
I
All
love
right,
the
let's
call
keep.
out to Dr. Fisher.
You
That's good stuff.
caught that one, didn't you?
Let's say hi to Jacob K. He dropped in and put in a question. I've pasted that into the anonymous question area for you to follow up on.
Perfect.
And
I
then
will type
Tam
it. Yeah.
Tam says that she was diagnosed with ocular aprasia after my first open sternum. It feels like having
Mm.
muscle spasms in my eye, and they feel like they are crossed.
Yes, I had them
Wow.
before my dissection, and it is scary. The first time I had it, I was at a movie theater, and the previews were playing, so I was looking at the screen, and then I looked down at the popcorn, which was close, and when I went back to look at the movie screen, they totally went cross-eyed, and I scared me to death. I mean, but it is cross-eyed. It is like you are sitting there seriously crossed. I mean, it's nauseating. You are off balance, and it scared me. And I just grabbed my eyes and I started pulling them apart because it's just natural reaction. And the doctor told me that when it happens, to try to relax as best as possible and take a lot of deep breaths in. The oxygen and just relaxing will help them come apart. It's like a calf muscle when you get that cramp in your calf. It's kind of like the same thing in your eyes, and it won't stay crossed. It won't stick. I thought I was going to be cross-eyed for the rest of my life.
You know, it's so interesting. So many things such as that, and the person that was talking about the blood pressure at 215, they tell you to relax and
Yeah.
breathe, but it's counterintuitive because you're so upset about what's
Yeah.
going on and what's happening. How am I going to stop and breathe? How am I going to relax when I'm worried as anything about what's going on?
Yeah.
It's
You're
really
totally too busy
backwards.
freaking out. Yeah.
Exactly.
I'm going to enter some of these questions. You want to just talk about our swag in general?
Oh, our swag. See, I love shopping. So I have a little bit of a problem, but our swag is amazing. We have everything from hats to hoodies to t-shirts to visors to bags to aprons to tote bags, not coffee bags, coffee mugs, water bottles, and if you've already have a water bottle and a coffee mug from us, the new ones totally different, and they're so nice. You would definitely want to order from Spread Shop. They are wonderful to work with. I had an issue with one of my hoodies that came. The printing wasn't up to par, and I emailed them, and I can go get another one if I want to. They gave me a credit. They are so wonderful to work for, and you can support and share your Aortic Hope swag everywhere you go. I think I have one, two, three or four sweatshirts, at least 5 t-shirts. I have t-shirts, 2 t-shirts for both my husband and my son, and a hat. Decal or stickers. Well, the decals, the magnets are not from them. The magnets are from us.
No,
but
magnets
still,
are
that's
special.
swag.
Yeah.
And
Yeah,
we
it's part
have,
of our swag.
yep, we have decals.
And
coming.
now, yeah, and you just mentioned what we're going to be adding to our order form is customized car decals, window clings. Now we're going to have window clings with a $5 donation. So, yeah. Oh, and I guess it's important to mention that the seatbelt covers are with a $15 donation if you're in the States and 20 if you're international. But be careful, all of you in the UK area, because I'm hearing that some of you have to pay a hefty fee to get your packages out of the post office. So I don't know what that's about. So I'm going to look into that.
The other good thing about the swag that I'll mention is that sometimes we post it, sometimes we don't, but we don't always catch it. But they have sales all the time. You can always get like a 20% off or 25% off. I don't think I've ever bought anything full price.
Yeah,
because
or
I'm
free
always
shipping.
catching it on a sale, free
Yeah.
shipping. I'm
Yeah.
always catching it on sale, and the stuff is amazing. And I have all kinds. You can get all kinds of logos. You can get our logo. You can get one that says Aortic Hope, like behind Karen. You can get any kind of logo. You can get the caregiver. You can get the caregiver's logo. You can get
God
there's so
Hope.
many of them.
There's a lot
Yes,
of different
God Hope.
things in there. And
There
you know what?
is a
If
lot
there's
of them.
we have football, we have baseball, and if there's a color or something that's not there, you can always send us an email at info@aorticope.org and we'll try to make it happen. We'll try to make it appear, you know?
Of course, I have an orange baseball one, and I have a purple football one.
Of
Orioles
course
and
you do.
Ravens.
Ravens,
course you
baby,
Of course I
Ravens.
do.
Yeah.
So
All right.
I believe
Yeah.
we have new Hope Mail for this year.
We
Oh,
do.
we do.
So yeah, this Hope Mail is kind of cool. So Hope Mail is a free it's a free initiative. You just sign up for it and we will send you basically like a token of an acknowledgement during your designated aortiversary month. Now, I know a lot of you have had more than one procedure or diagnosis or surgery. You got to pick one month. You only get one. Pick the month, sign up for Hope Mail. There are links on our website. And during that month, at some point during the month, you're going to get a handwritten note from us at the Aortic Hope team here and a couple items. And this year, so like last year's item was a it was a heart-shaped stress ball and a heart-shaped cool heated pack.
Cold pack.
Yeah. Right. Thank you, because I'm tired. This year is, what do we got? We got lip balm. We got that that touchy-feely
the
anti-stress
thing.
It's like a anti-stress strip. Blah. And you can put the backing on anywhere. You can put it at the back of your phone, on your desk, whatever. And it's just supposed to
called a calming strip.
Calming strip. Thank you. Strip. And you touch it and it's supposed to be calming. And then we also have a 4-pack of colored pencils and a coloring book, adult coloring book that has a lot of affirmations. We were asked by our mindfulness group if we would take some consideration in giving some items that would help with anxiety and stress. And so being that this year is how can you receive more in 2024, and it's about self-love and self-care, we thought these would be items that would just, there's the activity of coloring, but then you can read something lovely. There's the calming strips. There's that nice soothing lip balm. So just a different theme for this year. I hope you guys like it.
I love the idea of the coloring book, but every time you guys say adult coloring book, I start laughing.
No, it's not adult, like naked. It's not nakedness, but that would be funny.
Maybe we should not call it an adult coloring book. Maybe we should just call it a mindfulness coloring book. Or
that's actually what it's called.
Yeah.
Pretty sure.
Yeah.
All right. Newly diagnosed with an aortic aneurysm and now having shortness of breath. Could this be a reason, or is it psychological? So aortic aneurysms are almost always asymptomatic. And the interesting thing is people are living their life and then they think, let's say I've got a really bad upper respiratory infection, or I'm going to have, I'm having some issues with my kidneys, or I'm having issues with stomach pain. And they get a scan and they find that there's an aneurysm, well, it wouldn't be from the stomach, that would be abdominal, but let's say, whatever, they're having an issue in their lungs, and then they get a scan and it picks up an aneurysm. And now all of a sudden, I'm very symptomatic. I'm not saying that person isn't, but it's more times than not, people all of a sudden feel that I can't swallow, I'm coughing, I have scratchy throat. This is not, more than likely not from an aneurysm. I mean, you would need to be a teeny tiny body frame, large aneurysm, in an area that's sitting there, and you could very well have a symptom. I hear more symptoms in the abdominal, like a pulsating sensation, but I'm not here to judge whether you are or you aren't. But as Dr. Prakash says, they're almost always asymptomatic, no symptoms, but there are rare exceptions. So if your shortness of breath is new, kind of coincides with this, number one, check with your aortic specialist. It could be caused by a whole other different condition. Still important to rule out that there isn't anything going on. And if everything's been ruled out, then it doesn't hurt, regardless, to talk to a therapist, regardless, and get whatever anxiety could be there now that you have something in you. It's very scary. So yeah, that wouldn't hurt anybody. All right, let's see. I think I've answered all of those questions. And let's go update and see what else we've got. Hey, Rock from the Heart, girlfriend. What do we got going on with Rock from the Heart?
Rock from the Heart has 2 symposiums. One is in St. Paul, Minnesota, and they are going to have the symposium and a dinner that night. It's a survivor recognition dinner. Karen and I, and actually several other people, have been to the symposiums in Minnesota before. Yes, it's cold and it's in February. But they always have some kind of rock concert on the next night. And this year it is Sebastian Bach. Rock from the Heart has formed a huge relationship with Sebastian Bach. He supports, so you probably may have seen if you subscribe or are friends on Facebook with Rock from the Heart. He's done commercials and advertisements for them. They're also having, is she the drummer? Somebody from the Go-Go's. I forget.
Oh, yes. I forget her. Gina. It's Gina.
Yeah, but I forget what she did with the Go-Go's, but she is also going to be there and participating. She had some kind of heart thing, I think. I don't remember, but yeah, they do a fabulous job on their symposium. Then they're having another one in Fargo, North Dakota, where they're going to have Rick Springfield again. Rick Springfield, I know, they had Rick Springfield in Minnesota last February, and Karen and I were like back in our teenage years when we were like 16 and 17, going goo goo gaga for Rick Springfield. And but he will be in Fargo, North Dakota again, the Rock from the Heart. I think they're just going to have a dinner, not as much a symposium, but it's definitely something to check out. The other thing too, before I forget, they are doing a virtual. All of us have already signed up to do the virtual symposium, so that we can watch it and see it and listen to it and participate, even though we're not going to be there. We'll be in the comfort of our warm homes because it's really cold in Minnesota.
That is 100% true. And I'm glad you mentioned that, because if you can be there, you can still be there. You'll get a chance to see what's going on, I believe, like in the room. Let's see an amazing lineup of speakers, including some survivor stories, and you will have an opportunity to ask some questions as well. So check it out and consider attending an event. If you can't make it this year, consider going in 25. It's worth the trip. It really is.
It's worth the trip. It's worth the trip. And there's some, you have some free time, and we've always gone to Prince's house. Paisley Park is amazing.
Yeah, it is.
And it's just, if you've never been, I mean, even if you've never been to Minnesota or Minneapolis, it's really nice to see and to visit someplace else. The other thing I was going to say too with the virtual, like I said, most of us have signed up for the virtual. I do work full time, but I'm still gonna log on to the virtual every once in a while if I can. I think it's a Friday, so on Fridays I'm kind of a little bit slower. I'm gonna log on and check it out and see what's going on in between, my work. So I'm looking forward to it.
Let's put those secret headphones on.
Yes, they're behind my hair.
Yeah, exactly.
Amy and Pete Johnson do a heck of a job with Rock from the Heart functions, and one of the first ones I went to was probably 6 months after I dissected, and I probably sat there and cried most of the time.
Yeah,
because it's amazing. It's just an amazing event.
And speaking about dissections, aortic dissection, the patient guide, all over our website, front page, resources, Hope Shop. You can get yourself a hard copy. We are allowing one hard copy per household. Right now is the time to do it. While we would appreciate you considering a donation to help offset the cost of shipping, it is not a requirement. They're also always free to download. Tell your doctor about it and let them sign up, because we will send them a box of 25 books for free. Of course, we love a donation. We only operate based on donations from all of you and the grants that we're now able to obtain for the guide. But this guide is everything A to Z about aortic dissections, and just such an easy to read format. And it was written by patients, truly written by patients, and revised and tweaked by clinicians. So this is an incredible book. If you've had a dissection, but it's going to be even better, is a book coming out for family members about aortic disease. So, if you've had this dissection and you've got immediate family members, you kind of might want everybody to understand what aortic disease in and of itself is. And this second book that we've started putting together, and we have enlisted people to begin writing this book, is going to be about aortic valve disease, about aneurysms, where they are, all the sizing, how everything that goes into it, TVARs, TAVARs, open heart surgery, a little bit about dissection, medication, genetics, and support, pretty much following the same format as our first guide. The second guide will take over and kind of is the prequel. That's the way to describe it. It's a prequel. And that will be coming out. Hopefully we'll be launching that book early 25, but very soon we will be able to launch our aortic dissection, the patient guide, in Spanish. And we're very excited. We're 99.9% finished with that project. And then we'll be taking pre-orders from physicians to order their boxes of the Spanish guide. Kind of cool, right?
I love these promos. Cool. You ladies are doing wonderful. But
thank you.
Well, yes.
Shouldn't you talk a little bit about what's happening with Think Aorta coming up?
Well, so it's on my list. It's on my to-do list. I got it right here in my handy schmandy. But I love the guidance. So it's really exciting.
Not diaries. What's the word? Books. Never mind. Forget it. All those zillion things you have, notebooks that you have.
Yeah,
can't
I have
think
a
of the
lot of
word.
journals.
Journal. Thank you. I couldn't think of the word.
This is
It's
in the
late.
very,
I'm
and
tired.
of all the journals, I'm using a very tiny journal, very tiny with Post-it notes. Yeah, so what's great is this Friday, Aortic Hope will be joining forces with Think Aorta US to have a big presence at the Society for Thoracic Surgeons conference that's taking place in San Antonio, Texas. So we will be there among all of the big name medical device companies and tons of residents and medical students and fellows and talking everything thoracic. So this isn't just aorta, it's heart, it's lungs. And this is going to be our real big event to showcase this guide. And this is a guide that was endorsed by the STS. So it's so meaningful to be able to be present with a book of this quality that they actually endorsed. And we're really looking forward to that. And we have a couple few conferences that are happening this year. So yeah, we'll be chatting about those. So that is that one. Before we take this last question that has come up on Facebook, because while he may be at this for a long time, we sure can't be. So we would love to stay with you with all of this, but just know that coming up still this week, we have our we've got our hangouts on Thursday. That happens every Thursday. We also have another Thursday at 2 p.m. Eastern. You got to sign up with the support group registration form once, and then you'll be notified about how to join. Qigong with Kevin Songer. He is a community member, a survivor. He's going to be doing another installation of teaching us Qigong, 7 p.m. Thursday night. Next week, we add in our weekend review hosted by Tammy on Monday, followed by our support group meeting, the one that happens in the evening at 7 p.m. Wednesday night. Again, Hangout Thursday, Qigong Thursday night. So we also have on Tuesday night that live event. So if you click the bell, guys, you'll be notified to join us on next Tuesday night. And then we'll have an opportunity, it's the 30th, to take your questions about the Social Security disability process and what navigating those waters look like now in 2024, which thankfully, I think it's a little bit better than it was in 2021. So we'll see how that goes. All right. Is it important to know how many layers you dissected? Someone must have been tuning into what we were saying.
Exactly.
Okay. Can a doctor tell from a CT scan? Dissection. Okay, here, you ready for this? This is going to make you, it's going to make me not want to move and to live in a hamster bubble wrap. Dissections almost always involve 2 layers.
That's what I thought.
The intima, which we know is the inner layer, and the media, which is the middle layer. By definition, they do not involve all 3. If they involved all 3, it would be a rupture, as what it reads right there. Yeah. So 2 out of our 3 layers have been compromised. We're down to one little old layer. Yeah. We are amazing humans. That layer is like wet tissue paper. That is what they describe it as. And we are functioning, and all of that oxygenated blood is getting to where it needs to go with one tiny little layer separating the blood from our body cavity. I am not going to sleep well tonight. Cheers. This you can't see it. It's water, but it should have been something else.
Yeah. But it's funny that you say that, because I was pretty sure that the first time I had the first time I had a dissection, that it was 2 layers. And because there's only 3. I don't know. I don't want to think about it either. I try not to think about it at all, that I have compromised aorta at all. I just live my life, and I'm thankful every day.
Oh, wait, I just saw another question. Here comes another question that was answered. Oh, got another question. We've got some questions we're going to have to handle before we go. Sorry, I'm keeping you longer. It is what it is.
Okay.
This person's husband is about to graduate nursing school in the spring, and jobs are asking what his weightlifting restrictions might be. His aortic specialist seemed hesitant to put a number on that form, but HR insisted, so they went with 50 pounds. I know, look, Dr. Ben Udelman always says 100. I think partially because he knows nobody's lifting 50 and walking around. And I mean, come on, we travel. Our suitcase probably weighs 42 pounds. Why do I know that? Because that's normally I get it right at that 42. And I do have to drag it out the trunk. So it's, you know what I mean?
Yeah.
But you know what happened? HR rescinded the offer and said he has to be able to lift more than 50 pounds. So is 50 pounds standard? Is it standard? Does it change depending on the patient? The husband is 35 years old, has Marfan syndrome, 1 year out since his dissection, dissected valve to iliac. surgical repair, and mechanical valve. And what Dr. Prakash said is specific weight restrictions are outdated. Outdated, and they don't reflect a person's ability, because people of different sizes and strengths can lift varying amounts without straining. And that is the key. It's the without straining part. That's the key thing. True. The limit that a person can lift without straining should be what the individual weight lift limit is. So if you can lift 100 pounds just through exhaling and you are not holding your breath, you're good to go. So that honest answer should be communicated with the employer. That's just really sad. That's pretty sad.
Especially because we need so many nurses.
Yeah.
And a nurse that is familiar with aortic disease would be even better.
Yeah, absolutely.
Mm-hmm.
All right. 2 cardiologists have said that their domain starts and stops with the heart. We just talked about this. They don't want to talk about aneurysms. And you know what my answer would be like? Then I don't want to be your patient. Sorry.
Find a new doctor.
Yep. If the aneurysm isn't large enough for surgery, however, the vascular surgeon then doesn't want to manage the case. So where are you? So you're sitting here with a 4.6. You're not large enough for surgery. Vascular's like, I don't want you yet. Cardiology's like, that's the aneurysm. I don't want you either. So how do you find support? Yeah. And Dr. Prakash said the Marfan Foundation website and the John Ritter Foundation for Aortic Health website both have professional directories of aortic specialists for patients who are looking for care. So again, if you have, and you can intertwine them, because whether you have Marfan syndrome or not, you could still use those doctors. So I don't want people to think if I don't have Marfan, I can't use them. Of course you can.
Exactly.
Of course you can.
Exactly.
All right, let me see if there's anything else that's new that's come in. I'm going to do one last check before we call it a night, but Dr. Prakash is still answering questions on our Facebook page, and I'll check the anonymous questions too real quick. Let's just see. All right, while I'm checking, you ready for a commercial?
Sure, what
talk about Lawrence Hope.
Oh,
you took it right out of my mouth. I was going to say, John Brenny does this thing where he always shows his little dog tags for Lawrence Hope whenever we have new people come into the Aorta Hangout, and he gets right in front of the camera. He's like, you get this.
You know what we need? We need a picture of him holding that so that I can, market it.
Mm-hmm.
Be great.
Well, Lawrence Hope is wonderful. Of course, if you go through our website, you will get a discount. And being a woman and being that I absolutely love jewelry, Lawrence Hope is wonderful, because not only do I have lots of jewelry, I have tags that go with them, the medical ID tags, and it has all of my pertinent information. It has my allergies. You can have whatever you want with it, and they will help you. You call them, set up an appointment, virtual appointment. They will help you decide how to write what needs to be written on your ID tag. It has my husband's name, it has my husband's phone number, it has my son's phone number, and it has what my conditions are, what I'm allergic to. And it's just not for dissections, for any kind of, it's a medical alert bracelet. Mm-hmm. You can get necklaces, you can get medical alert bracelets that look like a watch, even though it's not a watch, and lots of bracelets and necklaces. Some of them are sets. They come with earrings and bracelets. I have quite a few. All different colors, all different kinds. And it's not just for women, it's for men too. They have a lot of the men accessories as well. But yeah, go through our website, get a discount, contact them, let them help you determine what's on your tag. And they're not, I have a cousin that had a mitral valve replacement. Her husband had it. So she ordered a medical ID tag for him. I have no idea how much she paid for it. It's like this huge solid gold necklace that he always has, which is great, but she probably paid a fortune for it, where if you go through Lawrence Hope and she got it, she didn't even ask me. She should have. I could have given her information and got a discount through Lawrence Hope. And because they're less expensive, you can buy more than one. I am proof of that.
And yes, you are. And they're interchangeable, those bracelets. But what I also love about them is they have the free shopping service. So as you mentioned, they have really become quite well versed on aortic disease and the acronyms that are medically accepted by the first responder community. So they know, we always know that ICE stands for in case of emergency, but they know like how you would talk about having an IV contrast dye or a pacemaker or blood thinner.
Correct.
So you're not writing out the words. They know the way to shorten it so somebody else will recognize it. Okay. All right. Yeah, go ahead.
There was one more thing. Oh, shoot. I forgot what I was going to say.
Next time we meet, we're going to talk about pump head. All right. This person, last question for the night from us. This person's father had surgery for aortic dissection in early November. He's been having some dull pain between his breasts and armpits. Is this normal, and how long might this last? So I've heard of pain maybe on the right side where you have that extra cut underneath your collarbone, or maybe in your shoulders from how they position you. But this is interesting. But Dr. Prakash says chest pain after sternotomy, very common. So if your father had a type A dissection, the surgery probably involved an incision down the center of his chest through the sternum. These incisions can take, like 6 months, just the incision to heal. I always thought it was 3 months before you could at least stretch or reach up, and it's a full year. But the incisions can take up to 6 months to actually heal because the bone takes a long time to fuse back together. And during that time, people often experience chest pain. And if the pain is changing in frequency or intensity, please let your doctor know. All right, everybody.
What I was going to say.
What were you going to say?
Oh, the other thing about Lawrence Hope is they will accept HSAs.
Oh,
yeah. An HSA, yeah.
Or FSA. Sure.
I don't know about FSA, but I do know they do it. HSA. Want to
share with us what an HSA is?
Health Savings Account.
Okay.
It's through my employer.
Or flex spending account.
Right. It's through my employer and through my insurance that every paycheck I put money in that, and I have a credit card that goes with it, and I can just use a credit card. Right. And it'll take it out of there instead of my own account.
Yeah. Yeah.
Oh,
that's
you ladies
great.
did
Thanks,
such
Josh.
a good job today.
Thanks, Josh.
Thanks. This was a fun format.
Yeah, and I want to rub this in, Terry. I had to really go to bat to get Karen to understand. I was like, listen, why would you not want this on YouTube?
Well, so what's interesting is we've either had the doctor on YouTube or we've had him on Facebook. But this really gave us the opportunity to kind of capture many things at one time, which is awesome. Mm-hmm. So now we can get more people to know. We might get more questions coming in, and it's just a matter of copy paste and get it off to the doctor. So this was great. And again, if you have Facebook, please go to Aortic Hope Facebook page, because he is still presently, we're almost an hour and a half in, and he is still answering questions right now for everyone. So check out the questions we talked about here. The answers are still up. If you have anonymous questions and we happen to miss you tonight, we will make sure that he answers them, and we will get back to you with that information. And he will be back again March. We'll get him back in here in March. And I think we tried this the same. What do you think?
As long as it's when I'm not on vacation.
I'll make sure of that then. You and I will be chit-chatting because you're great at giving the commercials, and that's awesome. You are. You know how to sell some stuff, girlfriend. All right.
Thank
you
heart
to
hands
everybody
to Dr.
who
Prakash.
tuned in.
Big heart hands to Dr. Prakash.
Heart hands to Dr. Prakash. Wait, there was another way I saw somebody do this. What was it?
Oh, here we go. So once again, I want to say thank you to Molly Thomas, John Brenny, Jacob K, and Tam Tam for showing up into the chat and saying hi with us.
Thank you for remembering, everybody, because that part I didn't write down.
That was good.
And thank you. Yeah. And thanks, everybody. Terry and I had a great time. This was a lot of fun, and we hope to see you again in March. And that's when we're going to do it again. So there you go. All right. Thanks so much. Don't forget, these were just sharing the information from the doctor. All of this information should be used for you to take back to your own personal physician and start that conversation. But we appreciate you being part of our community. Click like, click subscribe. Until the next time.
Bye.